The information in this video is taken from the drug's package insert. If this video is useful to you, don't forget to like the video and subscribe to the channel. Share your experiences and questions in the comment section. I wish you healthy days. VOLTAREN belongs to a class of drugs called non-steroidal anti-inflammatory drugs. The active ingredient of VOLTAREN tablet is DİCLOFENAC. What is VOLTAREN tablet and what is it used for? VOLTAREN is used to treat symptoms of pain associated with rheumatoid arthritis, osteoarthritis, ankylosing spondylitis, dysmenorrhea, and mild to moderate pain. VOLTAREN may be used alone or with other medications. DİCLOFENAC is used to relieve pain, swelling, and joint stiffness caused by arthritis. Things to know before using VOLTAREN tablet are as follows. Before taking DİCLOFENAC, tell your doctor or pharmacist if you are allergic to it, or to aspirin or other NSAIDs, or if you have any other allergies. Before using this medication, tell your doctor or pharmacist your medical history, especially of asthma, bleeding or clotting problems, heart disease, high blood pressure, liver disease, growths in the nose, stomach intestinal esophagus problems, stroke. Kidney problems can sometimes occur with the use of NSAID medications, including DİCLOFENAC. Problems are more likely to occur if you are dehydrated, have heart failure or kidney disease, are an older adult, or if you take certain medications. Drink plenty of fluids as directed by your doctor to prevent dehydration, and tell your doctor right away if you have a change in the amount of urine. Before having surgery, tell your doctor or dentist about all the products you use. This drug may make you dizzy or drowsy. Do not drive, use machinery, or do anything that needs alertness until you can do it safely. This medicine may cause stomach bleeding. Daily use of alcohol and tobacco, especially when combined with this medicine, may increase your risk for stomach bleeding. Limit alcohol and stop smoking. Consult your doctor or pharmacist for more information. This medication may make you more sensitive to the sun. Limit your time in the sun. Avoid tanning booths and sun lamps. Use sunscreen and wear protective clothing when outdoors. Tell your doctor right away if you get sunburned or have skin blisters, redness. Older adults may be at greater risk for stomach intestinal bleeding, kidney problems, heart attack, and stroke while using this drug. Tell your doctor if you are pregnant or if you plan to become pregnant. This medication may harm an unborn baby and cause problems with normal labor delivery. It is not recommended for use in pregnancy from 20 weeks until delivery. If your doctor decides that you need to use this medication between 20 and 30 weeks of pregnancy, you should use the lowest effective dose for the shortest possible time. You should not use this medication after 30 weeks of pregnancy. This drug passes into breast milk. While there have been no reports of harm to nursing infants, consult your doctor before breastfeeding. How to use VOLTAREN tablet? Take this medication by mouth with a full glass of water unless your doctor directs you otherwise. Do not lie down for at least 10 minutes after taking this drug. If you experience stomach upset with this medication, you may take it with food, milk, or an antacid. However, this may slow absorption and delay pain relief, especially if you are not taking this medication on a regular schedule. Swallow this medication whole. Do not crush, chew, or break the tablets. Doing so can destroy the special coating on the tablet and may increase side effects. For certain conditions, it may take up to 2 weeks of regular use before the full benefits of this drug take effect. If you are taking this drug on an as-needed basis, remember that pain medications work best if they are used as the first signs of pain occur. If you wait until the pain has worsened, the medication may not work as well. Tell your doctor if your condition worsens. What are the side effects of VOLTAREN tablet? Remember that your doctor has prescribed this medication because he or she has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Upset stomach, nausea, heartburn, diarrhea, constipation, gas, headache, drowsiness, and dizziness may occur. If any of these effects persist or worsen, tell your doctor or pharmacist promptly. Tell your doctor right away if any of these unlikely but serious side effects occur. Hearing changes, mental mood changes, difficult painful swallowing, symptoms of heart failure such as swelling ankles, feet, unusual tiredness, unusual sudden weight gain. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching, swelling, severe dizziness, trouble breathing,